honourable member for Courtenay-Alberni.
Thank you, Mr. Speaker. Mr. Speaker, my colleague from South Okanagan, West Kootenay, talked about the sale of Chinese state-owned Anbang when they took over retirement concepts, and the Liberal government rubber-stamped that sale, and we saw the deterioration of service in retirement homes in Courtenay and my riding. And we know the evidence is clear that across Canada, even before the pandemic, for-profit long-term care homes led to worse outcomes for residents and staff alike, and that the pandemic has made the differences even clearer. Companies operating for-profit care homes across Canada made hundreds of millions of dollars this year and paid them out to shareholders, even to state-owned companies, Mr. Speaker. Does my colleague not agree that every single one of those dollars could and should have gone to improving care and making residents and staff safer in communities like where I represent, Parksville and Qualicum, the highest median age in the country, where we've got lots of private care homes? Doesn't my colleague agree that that money should be there, improving care and making residents safer and their staff?
The Honourable Parliament Secretary to the Minister of Health.
Mr. Speaker, thank you, and thank you to my colleague for the question. I absolutely agree that funding needs to go to service levels. What I disagree with, again, is the NDP coming forward with policies written on the back of a napkin that actually don't achieve the outcomes that they, I think, genuinely want to see. But, Mr. Speaker, if we can't say that every single for-profit provider, we heard examples from my colleague from Newfoundland where the service levels are quite high. And we need to look at this as a holistic approach about service standards. And I agree that the funding should go into service, but we need to do this in a holistic approach to ensure that the care seniors will receive is high quality and there aren't unintended consequences of an ill proposed policy by the NDP.